I wanted to talk to you about a pandemic of epic proportions. But the good news is that this pandemic is a pandemic that we can all do something about. The pandemic I'm referring to is the pandemic of loneliness. You may be wondering why a neurologist is interested in talking to you about loneliness. Well, I went into neurology since I was captivated by the brain. I love learning about what makes us each uniquely human. And let's face it, the brain is just really cool. I am a Western trained neurologist, and I run one of 6 centers of excellence in the country. And it's my passion to take care of veterans with Parkinson's disease. I spent the last 20 years taking care of patients living with Parkinson's and their families, and have been fascinated by what is the secret sauce that helps patients to do well. You can meet 2 identical patients on day 1 of their disease and follow them over many years, and they can end up looking very different. I've interviewed over 100 thought leaders in my field to try to understand what is that secret sauce that sets these patients apart. My own work and thinking have been deeply influenced by the work of Victor Frankl. Dr. Frankl was a Holocaust survivor who closely observed behaviors in the concentration camps to understand which prisoners survived the atrocities and what helped them to do so. He later went on to become a rock star neurologist, psychiatrist, and philosopher who wrote the game-changing book, Man's Search for Meaning. In the words of Victor Frankl, being human always points and is directed to something or someone other than oneself, be it a meaning to fulfill or another human being to encounter. Parkinson's disease is a challenging disease. When we think about Parkinson's, we think about motor symptoms like gait and tremor, but what really affects the quality of life of my patients is not just these motor symptoms, but really a host of non-motor issues like anxiety, depression, and apathy. In addition to my training as a neurologist, I sought out experiences in a number of different realms that aren't addressed in traditional neurology training. I did a yoga teacher training, a mindfulness training, and got boarded in integrative medicine, which is the area of medicine that bridges Western medical practice with other types of healthcare systems, like traditional Chinese medicine and Ayurveda. It also includes the mind-body approaches like mindfulness, meditation, and yoga, which I think can be transformational for our patients and honestly, for all of us. Yoga and mindfulness help me every day to find balance in my hectic life as a busy mom of 3 boys and as a neurologist. I became passionate about the concept of wellness and whole health, and defining health not just as the absence of disease, but truly a more holistic concept of complete physical, mental, and spiritual well-being. I started going to meetings in the integrative medicine arena and started to learn about the determinants of health, and I hadn't learned about these in medical school. We learned that when patients feel like they are in control of their outcomes, they are more engaged and their quality of life improves. In empowering patients, it's important to meet people where they are and understand them from their unique cultural context. It's not a one-size-fits-all approach. We're realizing in medicine that how we approach patients and deliver bespoke healthcare is critical to serving all patients from different cultural backgrounds. One thing that's key is to understand what brings people joy and meaning and to help them find more of this in their daily lives. For some of my patients, that might mean playing with their grandchildren. For others, it might be salsa dancing with their wife. I also learned about the importance of social connection. I learned that loneliness is worse than smoking a half a pack of cigarettes per day or being obese. In veterans, loneliness increases depression, anxiety, substance abuse, and suicide risk. The importance of mental health has really been under-recognized and undervalued in our society today, but it poses a major risk for health outcomes and quality of life. There is a stigma with being lonely. People feel that they're unlikable and somehow that's their fault. People don't realize how isolated they've become, and they don't come forward to tell their doctors or loved ones about this hidden affliction. Healthcare providers often don't know to proactively ask about loneliness and may not be aware of possible interventions. It's important to understand the definition of loneliness. It's really the subjective feeling that's created by the gap between desired relationships and what we perceive our relationships to contain. It's also important to understand that there's 3 spheres of loneliness that need to be met. There's an intimate sphere that can be fulfilled by a connection with a spouse, a relational sphere that can be filled by a friend circle outside the home, and then there's this collective sphere where it can be fulfilled by a connection to a group in society with a shared sense of purpose. For my veterans, it might be becoming, involved in a veterans cause, a Parkinson's support group for my Parkinson's patients, or whatever your passion is, like global warming, bird conservation, whatever floats your boat. A person can still be lonely even if they are happily married if these other 2 spheres of connection are not met. We embarked on a research project to understand the modifiable variables in Parkinson's disease patients. We surveyed over 2,000 patients with Parkinson's since we wanted to understand and guide our patients about lifestyle choices that they could choose every day to help them feel more in control of their health. Well, we all know that exercise is medicine. Our study showed something surprising. We showed that being lonely is as bad for you as the beneficial effects of exercising 7 days a week or 30 minutes a day was good for you. It drove us to really want to help patients to get socially connected. During my research, I became enthralled with the concept of social prescribing. Vivek Murthy, the Surgeon General, describes this in his beautiful book, Together. Social prescribing is a novel concept in which I, as a doctor, can literally write a prescription for a patient who's lonely to get social support in their community. The National Health Service has started implementing these types of strategies in the United Kingdom. And some of the social support ideas engage churches or choirs, dance studios, or gardening groups. It's really pretty brilliant, actually. The VA has a model of this type of intervention called the Compassionate Contact Corps, where clinicians can write a consult to connect lonely veterans to volunteers through proactive phone calls or video visits. And the cool thing is that volunteerism can actually have a tremendous beneficial effect for the volunteer as well. So it's kind of a 2-for-1 bonus that everyone gets better. I love rethinking about new ways to support holistic health in my patients. I think we can really have to really rethink the concept that I in my white coat in my ivory tower is going to be the sole provider of healthcare for my patients in that 30-minute appointment once in 6 months. And I'm actually pretty lucky because a lot of my colleagues only get 15 minutes with their patients. I hope we can work together to take healthcare into the community with a multidisciplinary team approach to truly help our patients and their families to live better every day. This team may include not just the physical therapist or a social worker, but even the imam or the pastor, a yoga or Tai Chi instructor. Whoever can cheerlead for my patients is welcome. I hope I was able to share some of what I've learned with you and what I know to be true about the importance of social connection and health, and that it is in fact a basic human need, just like food, water, and shelter. It's a basic human nutrient to have social connection. I want to urge you to think about how we can all make a difference in our neighborhoods, in our own pockets of the world, in our own backyards. I urge you to think about that isolated neighbor on your street or someone on your Christmas card list that may have been forgotten and reach out to them. Our research shows that just a daily phone call or video call can make a huge difference. As Victor Frankl said, the more one forgets himself by giving himself to a cause to serve or another person to love, the more human he is. Thank you and namaste.